But we begin with breaking news just moments ago. The CDC's advisory panel voted to lift the pause on the Johnson & Johnson vaccine and recommend its use in those over the age of 18.
The vote 10 in favor, 4 against with 1 abstention. The outside panel of experts said the benefits of the single-dose vaccine in preventing COVID-19 infections and deaths clearly outweighs the risk. But some wanted additional guidance provided to people who will be getting the vaccine.
The FDA will now include a warning statement with the emergency use authorization detailing the risk of rare blood clots, particularly in women under the age of 50.
Panel met for 6 hours this afternoon and revealed new information about the risks, especially in younger women. Out of the nearly 8 million doses given, there have been 15 confirmed cases of the rare blood clots, including 3 deaths. 7 people remain hospitalized. All of the cases have been in women, but the CDC stressed that doesn't mean there's no risk for men.
There could be cases that simply weren't reported, and there could be cases that become apparent later on that just have not appeared. But as of now, we had 0 cases in males.
The symptoms of these rare blood clots develop 6 to 15 days after receiving the vaccine.
These initial symptoms are fairly vague and nonspecific, mainly headache. But importantly, the headaches for these started 6 or more days after vaccination.
None of the patients had a previous history of blood clotting disorders. 7 were obese. 2 were using oral contraceptives. The highest risk was in women aged 30 to 39. In that age group, the risk was 11.8 cases per million. But the manufacturer of the J&J vaccine stressed there are unique benefits to having a single-dose vaccine that can be stored at refrigerator temperatures. Again, this decision just coming out now, announced here within the last 5 minutes or so. But the CDC also stressed during the meeting that none of these rare blood clots have been detected in association with the Pfizer or Moderna vaccines.